Put on clean gloves. Loosen the top linens at the foot of the bed. Remove the bedspread and blanket separately. If they're soiled, place them in the linen bag. If either is to be reused, fold the item into a square and place it over the back of a chair. Cover the patient with a bath blanket, placing it over the top sheet. Ask him to hold the top edge of the blanket or tuck it under his shoulders.
Okay, I just want to hold this top sheet right here.
Sure.
Then reach beneath the blanket and remove the top sheet, discarding it in the linen bag. Encourage him to use the side rail to turn. Then adjust the pillow beneath his head. Make sure no tension has been placed on any extra.
So I'm going to have her lift the leg closest to me with her knee bent and her foot placed completely on the bed. And then her other leg farthest away from me, bending her knee just a little bit. Then I'm going to have Mrs. Smith take her arm closest to me up over her chest, and then I'm going to have her take her arm furthest away from me up over her head. And then I'm going to help Mrs. Smith roll over to her side. On the count of 3, Mrs. Smith, we're going to roll to the side. 1, 2, and 3. Perfect.
Internal medical devices, such as indwelling catheters, wound drains, and IV tubing. Standing on one side of the bed, loosen the bottom linen, moving from head to foot. Fan fold or roll the bottom sheet and any optional linen toward and under the patient. Tuck the edges of the soiled bottom linen alongside the patient's buttocks, back, and shoulders. Then clean, disinfect, and dry the mattress. Remove your gloves and perform hand hygiene. Next, apply clean linen to the exposed half of the bed in separate layers. First, place the fitted bottom sheet on the bed lengthwise. Secure the top and bottom corners on the near side, and fan fold or roll the remaining fabric 5 centimeters or 10 inches over the edge of the mattress. Be sure that the lower hem of the bottom sheet lies seam down and even with the bottom edge of the mattress. To miter the top corner of the flat sheet at the head of the bed, lift the top corner of the mattress with one hand. With your other hand, tuck the top edge of the bottom sheet smoothly under the mattress. Pick up the top of the sheet about 45 centimeters or 18 inches from the top of the mattress. Lift the sheet and lay it on top to form a triangular fold. Tuck in the lower, free-hanging edge of the sheet. With your palm facing down, tuck the remaining portion of the sheet under the mattress, being careful not to pull out the triangular fold. Then, tuck the remaining portion of the sheet under the mattress, moving toward the foot of the bed and keeping the linen smooth as you go. Place the draw sheet or waterproof pad lengthwise along the middle of the bed and tuck the remainder under the patient's torso and buttocks. The pad should be fan-folded or rolled on top of the bottom sheet. Keep the linen beneath the patient as flat as possible because you'll have to roll over these layers when you're ready to make the other side of the bed. Now, raise the side.
Okay, and you're gonna feel a big hump.
Help him roll toward you, making sure he turns slowly and keeps his body correctly aligned.
So go ahead and roll towards me. Okay,
Yeah.
you doing okay?
Move to the opposite side of the bed and lower the side rail. Loosen the edges of the soiled linen from beneath the mattress and remove it by folding it into a bundle or square and holding it away from you as you place it in the linen bag. Then clean, disinfect, and dry the other half of the mattress if necessary. Remove and dispose of your gloves. Raise the side rails. And perform hand hygiene. Now, lower the side rails and pull the clean, rolled linen and draw sheet or waterproof pad over the edge of the mattress from the head to the foot of the bed. Pull the corners of the fitted bottom sheet over the edges of the mattress. Then help the patient roll back into a supine position.
Okay, Mr. Hayes, I'll have you roll back over to your back.
Yeah.
You move the pillow over. There you go.
For him with a top sheet, placing the vertical centerfold lengthwise down the middle of the bed. Open the sheet out from head to foot as you unfold it over the patient. Be sure the top edge of the sheet is even with the top edge of the mattress. Ask the patient to hold on to the sheet and blanket as you remove the bath blanket. Place a clean or reused bed blanket over the patient. Make sure the top edge of the blanket is parallel with the top edge of the sheet and about 15 or 20 centimeters, that's 6 to 8 inches, from the edge of the top sheet. On the other side of the bed, spread out the sheet and blanket evenly. Then make a cuff by turning the edge of the top sheet down over the top edge of the blanket. Standing outside the bed, tuck the main portion of sheet and blanket under the mattress. Tie the top sheet and blanket together. Taking turn on both sides of the pillow. May modify the corner with top sheet and blanket. To do so, simply tip the triangle hanging, wrap the tuck in, and ready to fold. Now finish the other side of the bed. Make the horizontal keep by standing at the foot of the bed and folding the sheet and blanket 5 to 10 centimeters or 2 inches. Apply a clean pillowcase. First, pick up the center of the closed end of the pillowcase. Hold the pillowcase with a firm grip in one hand. With the other hand, open the pillowcase from the open end and fold the back over the closed end inside out. Next, pick up the pillow with the hand holding the pillowcase. Invert the pillow for the pillowcase to drape over the pillow. Then, pull the pillowcase over the pillow with the other hand. Do not place the pillow or pillowcase under the chin or in the teeth. Adjust the corners of the pillowcase with your hands between the pillowcase and the pillow. Do not shake the pillow to position the pillowcase.
Okay, Mr. Hayes.
Assist the patient into a comfortable position.
Is that comfortable?
Yes, thank you.
Okay.
To ensure the patient's safety, lower the bed to the lowest position and raise the appropriate number of side rails. Remind the patient of the location of the call light.
Okay. Here's the call light, the call me, this red button right here, if you need anything.
Then arrange and organize the patient's room. And perform hand hygiene.
Clean tray containing Macintosh with towel, small bowl with normal saline, small bowl with mouthwash solution, clean gloves, gauze piece, Vaseline, kidney tray and paper bag. A sterile tray containing tongue depressor, artery forceps, thumb forceps. Place a towel and Macintosh under the patient's head and spread one towel over the chest and keep a kidney tray under the chin. Wrap the gauze piece around the artery forceps, covering its tip. Moist the gauze piece with normal saline or dip in the cleaning agent. Squeeze the extra solution. Separate the upper and lower teeth with padded tongue depressor by inserting it quickly and gently if required. Swab each tooth gently but firmly and clean all the sides.
Nasogastric tube feeding. What is available like rice or ragi soup, vegetable and dal being the feed. Articles needed. Prepared feed 200 ml, 50 ml syringe 1, 50 ml of clean water, 1 towel, 1 pair clean gloves, a kidney tray and
Please refer to the video on how to prepare milk feeds and medications for more information. Now, let us proceed with preparing your procedure that removes phlegm. Please perform it before the feeding. Fully positioned in the stomach. To check the position of the tube. 1. Make sure the tube is secured to the nose by a plaster. Check that the marking tape on the tube is located outside the nostril. 2. Gently open your care recipient's mouth and check that the tube is not coiled or twisted inside.
Position the patient with the head of the bed elevated at least 30 to 45 degree angle or raise the chest with extra pillows. Wash hands and wear clean gloves. Place a towel over the patient's chest. First, check the position of the feeding tube. For this, pinch or fold the end of the tube to prevent entry of air and then open the cap. Attach a 50 ml syringe to the nasogastric tube. Aspirate the stomach contents and verify the position of the tube. Return all aspirated gastric contents to the stomach. If the aspirated fluid is less than 50 ml, feed can be given. After the tube placement is confirmed, remove the syringe and close the end of the feeding tube. Then, remove the piston from the barrel of the syringe. Pinch the feeding tube and attach the barrel of the syringe to the tube. Then, fill the barrel with 25 ml of water and allow it to flow in by gravity by raising the barrel above the level of the patient's head. Pour prepared feed into the barrel when it is 3/4 empty. Give the feed slowly without air entry. Give a total of 200 ml of prepared feed. Total quantity of feed plus water should not exceed more than 250 ml. Flush the tube with at least 25 ml of plain water. Pinch the tube whenever necessary to prevent air entry. Remove the barrel and close the end of the feeding tube. The tube can be alternatively secured to the cheek to prevent ulceration to the surface of the nose.
If you notice any signs of aspiration, such as persistent coughing or shortness, please seek medical advice. After feeding, remember to wash your hands and the items used. You should keep all items clean and dry until the next feeding. Attempt to keep your care recipient in an upright position for at least half an hour after feeding to minimize the risk of stomach contamination.
Replace the articles. Remove gloves. Wash hands. Catheter, adhesive tape and scissors. Read the patient. Explain the procedure to the patient and take consent. Provide privacy to the patient. Wash hands. Wear clean gloves. Prepare water to be used for procedure. Test the temperature of water. Place the patient in supine position. Place Macintosh and towel below the perineal area of the patient. Remove anchor tapes to free catheter. Retract foreskin and assess for signs of inflammation and discharge at the catheter site. Wash tip of the penis using circular motion with soap and water. Discard the used washcloth. Then clean with a clean cloth. Replace foreskin to its position. Remove gloves. Pour normal saline into the bowl. Wear sterile gloves. Using gauze swabs dipped in saline, clean the catheter from the urethral opening outwards for 3 to 5 cm. Repeat again. Secure catheter to the thigh with adhesive tape. Remove used articles. Remove gloves and wash hands. Place patient in comfortable position. Water. Wipe in direction from perineum to anus. Repeat on the opposite side using a separate section of the same washcloth. Separate the labia majora and clean thoroughly around the labia minora, clitoris and vaginal orifice using a separate cloth. Remove gloves. Pour normal saline into the bowl. Wear sterile gloves. Using gauze swabs dipped in saline, clean the catheter from the urethral opening outwards for 3 to 5 cm. Repeat again. Remove used articles. Secure catheter to the thigh with the adhesives to remember. Always wash hands with soap and water before and after handling a urinary catheter and urobag. Always ensure the catheter is kept secure to prevent irritation of urethra. Check for urinary leakage. If present, identify the cause and manage appropriately. Maintain a sterile continuous drainage system. Keep the catheter and draining tube free from kinking. Maintain unobstructed urine flow. Keep the urobag below the level of bladder at all times. Do not rest the urobag on the floor. Do not allow the urobag to fill beyond its 2/3 capacity. Prevent contact of drainage outlet with the non-sterile collecting container. Observe the urine color for identifying any infection. Place the urobag as shown in wheelchair, walker. To provide dignity to the patient, the urobag can be placed inside a cloth bag as shown. Patients should be encouraged to have a good fluid intake of at least 2 liters per day. Ensure regular bowel movements. Perform catheter care daily once and after bowel movements.